Hi, I'm Dr. Wilfred Koon, principal dentist here at The Point Dental. If you're watching these, chances are you've been wondering about all-on-4 dental implants. But maybe you're feeling a bit unsure because of all the myths and mixed messages out there. Maybe you've heard that they're expensive, that they're painful, or that they're only for old people, or that they look fake. Well, in this video, I'm here to clear things up. I'll walk you through the 10 most common myths I hear from patients and share the honest truth about what All-on-4 can do for you. Myth number 1. All-on-4 dental implants are too expensive and only for the rich. Now, you might think All-on-4 dental implants are something only the wealthy people can afford, but honestly, that's just not true. Most of our patients are actually regular everyday people. Teachers, nurses, truck drivers, construction workers, people who simply had enough of struggling with their teeth and are ready for a change. Yes, the upfront cost can seem high, but compared to traditional implants, All-on-4 is actually more affordable. It uses fewer implants, avoids bone grafting, and involves fewer surgeries, and making it a cost-effective solution in the long run. And with payment options like interest-free payment plans and early access to super, it's becoming surprisingly accessible to many people. But beyond the dollars, what's truly priceless is the change we see in people's life. Patients come back and tell us things that truly touch us. They've started a new relationship, they've got promoted at work, they have stopped avoiding social events, and finally they feel like they're actually living a normal, purposeful life again. For them, it's not just about the cost, it's actually about getting back their confidence, their freedom, and the chance to actually show up in life again, not only for themselves but also for their families. Myth number 2. All-on-4 dental implants in 3 days is just advertising bait. Now, you might be thinking All-on-4 dental implants in 3 days is too good to be true. There must be a catch. But the truth is 99% of our patients actually get their new teeth in just a few days after the surgery. And these are teeth that you can actually smile with, eat with, and that you don't actually need to take out at night. With All-on-4, everything is done in one surgery. We remove your remaining teeth, we clear all the infections and place all the implants all in one go. And the next day, we do a test run to make sure that your teeth fit well and they look good. And by the following day, just 3 days after the surgery, you get your new smile. Of course, that's just the first step. Over the next 6 months, we will make adjustments and refinements before we give you your final set of teeth once everything is healed and settled. And that's the beauty of All-on-4. You actually get to enjoy your teeth immediately while your body is still healing. Myth number 3. All-on-4 dental implants require multiple surgeries and a long, painful recovery time. Now, this is a common belief, even among dentists who don't do All-on-4s. Many people actually assume that they will need several surgeries stretched over a long period of time with long and painful recoveries in between. And while that's often true with traditional implants, with All-on-4, it's simply not the case. All-on-4 is designed as a graftless single surgery solution. And instead of needing bone grafting, sinus lift, or multiple procedures, everything is actually done in one surgery. And as we have touched on earlier, you actually walk out with a full set of fixed teeth in just a few days. And of course, recovery is always part of any surgery, and we're always upfront about that. But because there's no bone grafting involved, the recovery is actually a lot simpler and much shorter. Most of our patients actually experience a little bit of swelling and discomfort for about a week or two, and after that, they're pretty much back to normal life. So no, with All-on-4 dental implants, you don't actually need multiple surgeries with extensive recovery. It's all about helping you get back to living your life as quickly as possible. Myth number 4. All-on-4 dental implants are painful. Now, this is a big fear for many people, and it's completely understandable. The word surgery always sounds scary, and doing everything in one long procedure can sound even scarier. But here's the truth. All-on-4 is far less painful than most people expect. With modern sleep dentistry, you are completely asleep the whole time. You don't see anything, you don't hear anything, and you certainly don't feel anything. And no, you won't actually wake up halfway through. And as you wake up, we'll make sure your mouth is fully numb, so you will always remain comfortable. After the procedure, we will give you strong pain relief for the first few days, which usually works really well. Yes, there's some discomfort, some swelling, a bit of soreness, but most of our patients are actually surprised how manageable it is. They often say that it's more discomfort than pain. And within a week or two, most people are back to their normal routines. Of course, everyone is different, and yes, a very small number of people might experience more pain than others, but that's the exception and not the rule. So if you're scared of the pain, please know this. It's a lot gentler than you imagine, and we're here to guide you through every step of the way. Myth number 5. All-on-4 dental implants are only for old people. Now this couldn't be further from the truth. All-on-4 isn't about age. It's about finding the long-term solution for people who have lost or about to lose all their teeth. And we have treated patients as young as 20 years old and as old as 85 years old. We have seen young adults who have lost their teeth due to severe oral health neglect or drug use, middle-aged people who have struggled with dental issues their whole life, and even older adults who simply just want to enjoy their later years without the hassle of dentures. So it's not about how old you are, it's about your oral health, your goals, and your desire to get back to living confidently. Myth number 6. You can't have all-on-4 dental implants if you have gum disease. Now, this is one of the biggest misconceptions we hear about all-on-4. With traditional implants, yes, this used to be true. You often have to wait 2 or 3 months after treating your gum disease before you can actually do any dental implant work, just to reduce the risk of infection. But with all-on-4, it's a completely different approach. All the gum and bone infections are carefully removed during the same surgery, and the implants are placed right away. Unlike traditional implants, we don't actually need a lot of bone, just a solid, healthy bone deep at the base of the jaw. This means that even if you have advanced gum disease or severe infections, you can still be a candidate for all-on-4. Myth number 7. All-on-4 dental implants require bone grafting. This is a common concern, as we have touched on quite a few times previously. Bone grafting isn't needed with all-on-4. In fact, if a dentist is doing bone grafting as part of their all-on-4 procedure, they're actually not really following the proper all-on-4 technique. For those who aren't familiar, bone grafting is a procedure to grow the bone where it's been lost. And while this is possible, it usually takes about 6 to 12 months for the bone to grow, and often what we're creating is actually more the volume of the bone and not actually the quality of the bone. The quality is actually not as strong as your original bone, and when it comes to implants, original is always the best. That's why all-on-4 has such a high success rate, about 98 to 99% success rate, because we place the implants directly into your natural bone and keeping the procedure simpler, safer, and more predictable. Myth number 8. You can't have all-on-4 dental implants if you have extensive bone loss. This is another common misconception. We have already talked about how all-on-4 doesn't require bone grafting, but you might be wondering, what if I've lost so much bone that there's almost no jawbone left to place implants? Surely there's a situation where all-on-4 aren't possible, right? Actually, no. That's not true. With advanced solutions like zygomatic implants, we can now use longer implants that actually ankle up to your cheekbone, completely bypassing the jawbone. And this is a highly specialized procedure, and about roughly 10% of our patients will need zygomatic implants. So no matter how extensive your bone loss is, with zygomatic implants, treatment is always possible, and importantly, it's still without bone grafting. Myth number 9. All-on-4 teeth are not as strong as natural teeth. Well, this used to be true. In the past, acrylic was the most common material used for all-on-4 teeth. Acrylic is a type of plastic. It looks great, but over time, it can chip or it can fracture, especially with heavy use. But this is no longer the case with modern materials like zirconia. Zirconia is a type of ceramic that's not only highly aesthetic, but also incredibly strong. In fact, it's even stronger than natural teeth. With zirconia teeth, you can eat nuts, you can have apples, you can enjoy your favorite food without actually worrying about them breaking. Having said that, it's still important to look after your teeth. Even though zirconia is strong, nothing is actually bulletproof, and nothing will last if you don't actually look after them properly. So good maintenance is the key to longevity of your all-on-4 dental implants. Now, last but not least, myth number 10. All-on-4 dental implants look fake. Well, this certainly can be true if they are not actually designed properly. And I've definitely seen a fair share of all-on-4 smiles that actually look fake, look unnatural, or they just look like they just don't belong in the person's mouth. But here's the thing, when they're done right, all-on-4 teeth should always look just like natural teeth. They should enhance your smile, help you look like the best version of yourself, and never make you look like someone else. And designing a smile is not just about putting all the teeth together. It's actually an art and a science, and it's about matching your facial feature with your personality and your lifestyle, and even the way your jaw moves when you talk or chew. That's why at The Point Dental, we only work with highly skilled cosmetic dental technicians, people who are truly master of their craft. And we always do smile trials along the way to make sure you love how they look before we actually finalize everything, because we actually believe that nothing should be left to chance. And predictability is always the key in everything that we do. And that's how we make sure your new smile will always feel natural, personal, and truly yours. So those are the 10 myths we hear about all-on-4 dental implants. And as you can see, the reality is actually very different from what people assume. And at the end of the day, this isn't just about replacing the teeth. It's about restoring your confidence, your health, and your quality of life. So if you're considering All-on-4, or just want to learn more about it, feel free to reach out or leave your questions in the comments. And we are always here to help you and would love to support you on your journey. And if you found this video useful, please don't forget to subscribe to our YouTube channel or follow us on Facebook and Instagram for more tips, patient stories, and behind the scenes of what we do here. So thanks for watching, and remember, a new smile isn't just about changing how you look, it's actually about changing how you live.